Hi, I'm James Stuckey. In this video, I'm going to discuss a number of the most common spinal pathologies you will encounter. Understanding common spinal pathologies will allow you to have clinical conversations with your surgeon customers about our products and how they relate to treating specific disease states. The definition of a pathology is a deviation from a person's normal state of well-being. Each pathology is classified by how it deviates anatomically and physiologically. I'll begin with bone density pathologies. Bone density is a measurement of the amount of calcium and other minerals in bone. A higher mineral content indicates a higher bone density and strength. As bone density decreases, there are several pathologies to consider. Osteomalacia is a reduction in the physical strength of bone due to decreased mineralization of osteoid. Osteopenia occurs when bone mineral density, or BMD, is lower than normal peak BMD, but not low enough to be classified as osteoporosis. And osteoporosis is the decrease in both the mineral and matrix components of bone. Now I'll switch over to disc-related pathologies. Spondylosis, or more commonly referred to as degenerative disc disease, is a general term for the condition in which a damaged intervertebral disc causes chronic pain. Degenerative disc disease may cause pain in the low back and legs if in the lumbar spine, or neck and arm pain if in the cervical spine. Degenerative changes in the spine can also result in a number of related spinal pathologies. Intervertebral disc herniation is a common back and neck disorder. It is one of the most common diseases that produces back pain and/or limb pain in adults. A herniated disc is a displacement of disc material, nucleus pulposus, or annulus fibrosus beyond the intervertebral disc space. This herniation process begins with failure of the innermost annulus rings and progresses radially outward. There are 4 names used to describe this type of pathology. In progressively severe grades, bulging, prolapse, extrusion, and sequestration. Bulging is an extension of the disc material beyond the margin of the vertebral end plates. A prolapse is when the outermost layers of the annulus fibrosus of the intervertebral discs of the spine are intact, but bulge when one or more of the discs are under pressure. An extrusion is what is commonly meant by the term disc herniation. This is when the nucleus material of a disc pushes out into the spinal column. While itself not necessarily painful, this condition can, and often does, compress a nerve, causing radiating limb pain, among other symptoms. And finally, a sequestration is when the inner nucleus pulposus leaks out through a tear in the annulus fibrosus and separates from the disc itself. Now let's discuss spinal stenosis. Spinal stenosis means an abnormal narrowing of the spinal canal or intervertebral foramen. It may be attributed to degenerative or arthritic changes of the disc, ligaments, and/or facet joints. The stenosis may result in compression of the neural elements within the spinal canal and the intervertebral foramina, causing radiculopathy and/or myelopathy. There are 3 types of spinal stenosis based on anatomical location: central, foraminal, and lateral recess stenosis. Central stenosis is the narrowing of the central spinal canal or vertebral foramen due to bony hypertrophy, ossification of ligaments such as the PLL and/or ligamentum flavum, anatomical displacement of one vertebrae over another, or bulging of a disc. Foraminal stenosis is the narrowing of the intervertebral foramen, where the exiting spinal nerve can be impinged due to far lateral disc herniations, facet hypertrophy, which means enlargement, or, more commonly, loss of disc height and/or spinal alignment, such as spondylolisthesis. Lateral recess stenosis is the narrowing of the space within the spinal canal adjacent to the exit zone of the nerve roots, often due to the hypertrophy of the facet joints, but can be caused by off-midline disc herniations or malalignments. All three forms of stenosis can be further classified by etiology. Degenerative spinal stenosis is acquired through progressive degenerative changes, whereas congenital spinal stenosis is a condition resulting from early developmental malformations. One example would be congenitally shortened pedicles resulting in reduced canal volume. The symptoms of degenerative disc disease and spinal stenosis can result in axial back pain symptoms and/or neural impingement symptoms. Back pain is believed to be a result of muscular, facet, and/or disc inflammation. Limb pain is a result of neural impingement. Neural impingement symptoms are classified into the following. Radiculopathy, or nerve irritation, presents as a radiating pain and/or weakness in a limb along the trajectory of that nerve's innervation pattern. Myelopathy, a compression of the spinal cord, presents differently. Because the spinal cord controls so much, the symptoms of myelopathy are less specific than radiculopathy. It may include general pain in both arms and/or legs, depending on the level of the spine where the stenosis occurs. Heaviness in the limbs, unstable walking, or even organ dysfunction are also symptoms of myelopathy. If it is not the spinal cord that is compressed, but the cauda equina, since the stenosis is in the lower level, below where the spinal cord ends, the patient might experience symptoms with similarities to both radiculopathy and myelopathy. Because more than one nerve root is compressed, the pain may not be so specific, but there may be both pain bilaterally in both legs, as well as heaviness, trouble walking, and even bowel or bladder issues. We call these symptoms of central compression of the cauda equina syndrome. This concludes part 1 of spinal pathologies. In the next video, I will talk to you about the remaining most common spinal pathologies you will encounter.